Welcome to my channel. The first 3 months of pregnancy can be filled with some fear and anxiety. For many mothers, it is the most physically and emotionally challenging time. However, by the 4th month of pregnancy, these issues begin to subside. The 4th month of pregnancy, which spans from 13 to 16 weeks, marks the start of the second trimester. Many people refer to this time as the golden period because the discomforts of the first 3 months, such as vomiting and fatigue, start to decrease, and everything begins to feel more normal. The mother's belly also begins to grow, as the baby's organs begin to gradually develop from this point on. That's why you need to start doing some things now and completely avoid others to ensure the baby's healthy development. So in today's video, I will discuss 1. What changes occur in the mother and baby during the 4th month of pregnancy? 2. What should and should not be done in the 4th month of pregnancy? Let's get started. Let's first discuss the changes in the mother's body during the 4th month of pregnancy. 1. Enlarged belly. During this time, the belly begins to expand slightly, although it may not be very noticeable. As the baby grows, the uterus also begins to enlarge gradually. This can lead to itching and stretch marks on the belly, which is normal because the skin is stretching to accommodate the growing belly. To relieve this discomfort, you can use olive oil or petroleum jelly on the skin. 2. Increased appetite. If you didn't eat properly in the first 3 months, your appetite will increase now. That's because your body is preparing to meet the baby's growing needs. 3. Breast changes. The breasts will become larger and more sensitive, and the areolas may become darker. This is completely normal. 4. Less vomiting and fatigue. Because the effect of the progesterone hormone starts to decrease, many mothers feel relief. In most cases, the symptoms of the first trimester become less noticeable. 5. Skin changes. Some mothers may notice a dark line down the middle of their abdomen, called the linea nigra. These changes become noticeable in the 4th month. 6. Leg cramps. A lack of magnesium or calcium can cause leg pain. Let's now discuss the baby's development in the 4th month. 1. Size. The baby is now about the size of an avocado, around 3 to 4 inches long, and weighs about 25 to 40 grams. 2. Organ development. The brain is developing rapidly, and the bones are beginning to harden. 3. Heart. The heart is fully formed and is pumping blood. 4. Hair and nails. They begin to grow. 5. Sensory development. By the end of the 4th month, the baby may start to feel sensations as the nervous system begins to develop. Baby movements. Starting from the 4th month, the baby begins to move its arms and legs. First-time mothers may not feel these movements yet, but those who are pregnant for the 2nd or 3rd time may start to notice them. However, an ultrasound can show the baby's movements. Now let's discuss what should and should not be done in the 4th month of pregnancy to ensure the health of the mother and baby. 1. Diet. The most important thing during this time is diet. Simply put, you can eat all halal foods during pregnancy, but make sure they are hygienic. Since the baby's growth accelerates during this time, protein is the most important nutrient. You can get protein from eggs, fish, and meat, and you should increase these foods in your diet. In addition, you'll need more calcium, vitamins, and minerals. It's advisable to drink at least 2 glasses of milk daily. Nuts are also a great source of protein and healthy fats. Include leafy vegetables and seasonal colorful fruits in your diet, or drink fresh fruit juice. Instead of imported fruits, eat local seasonal fruits like bananas, guavas, mangoes, lychees, jackfruit, ripe papaya, and coconut water. Drink plenty of fluids. In the 4th month of pregnancy, you need more nutrients than usual, so it's important to take iron, vitamin, and calcium supplements, as per your doctor's advice. Many mothers experience constipation during this time, so eat plenty of fiber-rich foods like leafy greens and vegetables. Drink at least 8 to 12 glasses of water daily. Avoid outside fast food and oily fried foods completely. Instead of eating large meals at once, eat small amounts frequently. 2. Sleep. In the 4th month of pregnancy, a mother should sleep for 2 hours in the afternoon and 7 to 8 hours at night. Try to sleep on your left side, although occasionally sleeping on the right side is also fine. Avoid sleeping on your back or stomach. 3. Sex. There are no restrictions on sexual activity during the 4th to 6th months of pregnancy, and you can have sex normally. However, avoid risky positions or those that put pressure on the belly. 4. Work. During the 4th to 6th months, you can do normal household work, but avoid heavy or strenuous work. 5. Smoking and alcohol. Smoking and drinking alcohol are strictly prohibited during pregnancy. Make sure your partner does not smoke either. Drinking alcohol during pregnancy can cause fetal alcohol syndrome in the baby. Avoid caffeinated foods like tea, coffee, dark chocolate, and even soft drinks, as excessive caffeine can lead to miscarriage. However, if desired, you may have 1 cup of tea or coffee per day. 6. Travel. There are no restrictions on travel during the 4th month of pregnancy. However, avoid transportation that causes too much jolting. Train travel is better than bus travel during this time. Long journeys are also okay. 7. Clothing. Avoid high heels, tight-fitting clothes, and belts. 8. Exercise. Gentle walking, light exercise, and yoga are recommended. Swimming is also good if you prefer. This helps increase the chances of a normal delivery. However, do not do heavy exercise. 9. Hygiene. Stay clean and take regular baths. During this time, it's also very important to take care of your teeth and mouth because infections in the teeth can cause premature labor. If you have any dental issues, see a dentist now. 10. Prenatal checkups. Make sure to have routine checkups like urine tests, blood tests, and ultrasounds. During this time, mothers can develop gestational diabetes. It's important to monitor the mother's hemoglobin, thyroid hormones, any sexually transmitted diseases, or urinary infections, because these can be harmful to both the mother and the baby. These issues can interfere with the baby's normal growth, so get tested and treated by your doctor. Also, medications from the first trimester may need to be adjusted or changed at this stage, so consult your gynecologist. If you have burning urination, excessive discharge, or vaginal itching, consult your doctor immediately. Special advice. 1. Do not eat raw or undercooked foods like half-boiled eggs, raw fish, or unpasteurized milk. Many believe that these have higher nutritional value, but raw foods can contain bacteria like Listeria or Salmonella, leading to infections. 2. Do not take any medications without consulting a doctor, not even painkillers, because many medicines can harm the baby's development. 3. Can you tell the baby's gender at this time? Yes, from the 4th month, an ultrasound can determine the baby's gender, although it's most clearly visible after the 5th month. However, in many countries, determining the baby's sex is illegal. 4. Vaccination. Certain vaccines, like tetanus and influenza, should be taken as advised by your doctor during pregnancy. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health-related videos. And remember to become a member of our family. Thank you for watching this video.